The British Association of Dental Nurses, proudly supporting dental nurses since 1940.
So hi everybody, my name is Sally Khawaja, and I am a registered dental nurse. So to give you a little start off and to know a bit about me first, I qualified many years ago, 1996 at Guy's Hospital. I did my training there. And from there, I've held a number of different roles. I've got a clinical specialist interest in dental psychology and special care and dental sedation. So they were the type of areas clinically that I was really drawn to. And I spent a lot of time working in different areas. And I then went into education. So I was the dental nurse training manager at King's College Hospital, overseeing the trainee dental nurses and the orthodontic therapy students as well. And there I led a team of tutors and assessors, internal quality assurers, and worked very closely with our external quality assurer. And I was also an external quality assurer with NCFA. So I've held like a number of roles over these years, and I'll just put down what we're going to be doing today. So yeah, identify the key individuals that we can that you can raise a concern with, identify barriers to raising concerns, create an environment to support individuals to speak up and listen up. So what is speaking up? Now, what do we think speaking up is? Is we can speak up about anything that gets in the way of us doing our job and delivering that care to our patients. And it could also be anything that affects you in your working life. It's, for example, if there's systematic team bullying and harassment, that can get in the way of you carrying out your work. If you feel something's not right, if you hear something's not right, it can also be where you might see improvements to be made. And recently I was with a group of student nurses. These were student general nurses, and I said to them, you can come and speak to us as well if there's improvements. And they actually, one of them did contact us after and say, I had some time on this ward and it was amazing, and I got lots of like tutoring, and I really felt that I learnt a lot, and it was really good practice, educating practice that I saw, and it'd be nice if this was demonstrated elsewhere. So it's not just about negative things, it could be about things that you've seen, you're like, that really works, or could we try X, Y, Z to improve things? It doesn't always have to be about if something's not right. So it's important to remember that. Now, there are also different ways that we can speak up. So we can speak up anonymously, and that can be sometimes, I do receive an email from somebody that's a made-up email address, so I don't know who it is. It could be sometimes I've got a work phone and people ring me from an unknown number, a note under the door. There are those ways. The only thing when people do that, we do take it seriously, and we follow up on what's happened, but I can't feed back to the individual, or I can't ask clarifying questions, but we take it just as serious as someone coming to sit with us. Confidential, you could have that confidential one-to-one discussion with someone and say, look, I've got concerns over X, Y, and Z. And then another way is listening sessions. So it could be that, I don't know, you get all the nurses together, or do you get a whole team from one practice and say, right, what can we do to improve things? What's going on? What are people not happy about? Those type of things. And I do that as part of my role. I'll go into different clinical areas and I'll do a listening session, and then on the back of that I put the themes and the trends together, but not attach anybody's names. And then I might go back to my exec team and say, look, I've sat down with this clinical area. These are the themes that are coming through. What are we going to do? And then I can feed that back. So that might be something you might think actually could work, where people may not want to individually speak up, but as a group, they could have a very constructive conversation. But for anybody to speak up, we've got to be in the right setting. We've got to have the right environment, and we need something called psychological safety. Now, psychological safety means feeling safe to take interpersonal risks, and that you need that to be able to speak up, to be able to disagree openly, to be able to surface concerns without fear of negative repercussions or pressure to sugarcoat bad news. And now what I always say is, it's not what you say, it's how you say it. So I've got 2 teenagers at home, and I use that quote quite frequently with them. You know, it's not what you say, it's how you say it, because it can really land differently. You've probably all know that, you know, how someone might say something, the way it lands can really change the outcome of that conversation. And then we've got 4 stages or 4 levels of psychological safety, and there's the inclusion safety. So think about when you join a new practice, you join a new team. You need that stage 1, that members feel accepted. They feel that they can be part of that team. They're not excluded from the group. From that, you can then develop into learner safety. And that's where team members are able to ask questions and experiment, make mistakes, admit when they've made errors, and even ask for help. You know, say, oh, I've made a bit of an error here. And you know you're not going to be condemned by it. It's going to be looked at something as a learning and not a blame culture. And the next stage is contributor safety. So that is making members, they feel safe. They feel safe to offer their ideas. So just visualise yourself in that team meeting. You know, you feel like you can say, do you know what, I've got a bit of an idea. Let's just listen, see what we all think. But you're not going to be, you haven't got that fear of being ridiculed or people shaming you for your idea. People are open to listen to each other. And you also feel that you're really adding value to a team. So, you know, they're positive contributors in the group. And then the final stage is that challenger. And that is feeling that you can challenge ideas and processes and being able to have the confidence to do that and knowing it's going to be received the right way. Okay, it's going to be accepted and viewed as, actually, let's have a look at this, what's being discussed, to see how we can improve. So practice manager, that's someone you can identify to speak to. So yeah, maybe we'll use the chat and Pam can be the chat monitor. Anyone else? Who else?
We've got practice managers, another colleague, line manager, head nurse, or mentor in practice.
Yeah, brilliant. So lots and lots of people you can identify there that you could reach out to. And we do know we've still got CQC. You know, I always say to people, if you feel that's the only way that you can speak up, that's fine, use that mechanism. And we know we've got the GDC. We also know you've got support in your colleagues at the BADN as well. So there's lots of different people that you can reach out to. Sometimes people come and sit and they say to me, do you know what, Dahlia, I don't know if I've come to the right person, and I don't know if I'm right in what I'm thinking. And I say, don't you tell me, and we'll have a chat. As they start to talk, they start to unpick what they've been seeing, feeling, or thinking, because it can be hard, can't it, to sometimes have those conversations. But when you actually go through it, you can start to, you know, break it up into elements in your mind, and then actually see what the situation actually is, and then look at how we're going to move forward. So sometimes I'll say to someone, what do you want to do next? Who do you think you can talk to? So often I provide that to support to help someone structure the conversation that they want to have with their line manager. Now, also, where do you think you can start to embed a speaking up culture? Has anybody got any ideas of how we can encourage not just ourselves, but our colleagues to speak up? What type of settings do we need?
Somebody's put practice meetings.
Yep, brilliant. So
team meetings.
Team meetings. Having those team meetings. And what I'm going to suggest, if you haven't got it already, that you really encourage people to say, okay, has anybody got anything they'd like to talk about? Has anybody noticed any ways that we can improve? Enable everyone to have that conversation, especially when you've got that any other business. We know there's some conversations there's just not going to be appropriate in a team meeting, but there are some conversations that we're all professionals, so we can make that judgment of actually it's not appropriate to have this conversation in this setting. If we think away from team meetings, how else could we support people to speak up? What other environments could someone have that opportunity to speak up?
Actually, sometimes people do contact BADN, and at the very least we listen, which sometimes helps if people, as you say, then set out their issue. And then we try to point them in the right direction. So it might be our legal helpline, for example, or it might be their indemnity providers, because obviously they have a role in this, or it might be perhaps ACAS, or again, sometimes their principal dentist or their employer, because people often don't. But as you say, that is a judgment call. You kind of have to be on the spot to know if it is appropriate to talk to your principal dentist or your employer, if they're actually going to listen. And sometimes we anonymously, on the behalf of the member, take it further, perhaps to an appropriate authority, and ask them for advice, which we then pass on to the member concerned. So we don't obviously release the member's details to that authority, but we act as a go-between. So very often people do that. I think Pretty's got her hand up too.
Yes, I do. In my practice where I work, my practice manager has got this open door policy. So at any time we can go to her, have a one-to-one. And even during our appraisal, there's a section on the form that says, like, do you have any concerns regarding anything? Is there anything we can help you with? But like Pam said, we do get quite a few questions that come through to the BADN asking for advice as well. And we do our best to answer them. But if we are not sure, we always refer them to maybe their indemnity provider to be able to help them out.
Yeah, no, definitely. So those are the type of things, like having one-to-ones, regular one-to-ones, give people the opportunity to maybe broach a conversation. Also, looking about having surveys of staff. You can gather a lot from that, finding out maybe it's a common theme going along that people don't want to maybe outright say, but in a survey, a number of them might say, something that makes you think, oh, I need to explore this a little bit further. So there are all ways that you can start to embed a speaking up culture. But as Pam rightly said, you can have a speaking up culture, but you've got to have a listening up culture. There's got to be someone to listen and be willing to actually hear what's being said. Now, someone said earlier about barriers. We do know that there are barriers. There's no getting away from that. One of the barriers, I'm going to say, is what's often been referred to as the hippo, and that's the highest person's opinion in the room, the highest paid person's opinion in the room. And that basically is often the person who is the highest paid their opinion, it feels it counts overall. And what I often have when I maybe speak to some of our senior leaders, they say, well, why didn't the individual come to me? You know, I'm very approachable and I would have listened. And often I say, I know you feel you're approachable and you are approachable to the right people and you do listen, but for some people, they feel your opinion will trump anything they say because of your actual status, and that does get in the way. And I think, you know, senior leaders do need to recognise that. So that could be your principal dentists. They do need to realise it's not always easy for someone to speak to them. Can we think of some more barriers? So maybe Preeti and Pam, if you could read some comments in the chat, of if people
Yeah,
can
sure.
list some barriers that they can identify.
I can say that very often when we get queries in the office, particularly in small practices, one of the barriers is the dental nurse feeling that she will lose her job.
Yeah, absolutely. So it can be that, well, that detriment to speaking up.
Yeah.
That you might lose your job or lose out on an opportunity.
Yeah, we've got two things in the chat: being a new member of the team and stigma and taboo.
Yeah, absolutely. Now, there's also such as it could be members of an ethnic minority group, staff with disabilities. Also in my role at King's, I'm co-chair of the King's Able Group, which is the staff disability and long-term impairment network. And I do have a lot of staff come to speak to me, and they do worry that they may be, that it may be more of a barrier to speak up because they feel they could be at a disadvantage already because they've got a disability or impairment. People that have spoken up before, if you've spoken up before and you've not received a good reception to speaking up, that can be a barrier for someone to speak up again. Students, trainee nurses,
Sorry, Anna has put being afraid of coming across as rude or hateful towards another colleague if you're raising concerns.
It being viewed as maybe it's a spiteful attack, that type of our trainee nurses, our trainee dental nurses, they can feel very vulnerable and face barriers. Staff that are part-time, staff that are on visas. We've also individuals that come from cultures where speaking up is not something you would do. Come from a very hierarchical structure. The fear of what's going to happen if I speak up, and then futility, and that is, what's the point? What's the point of speaking up? Because nothing's ever going to change. So these are all the barriers that people can experience, and there can be more. But what I'm going to urge all of you is to take these barriers and think about how can you reduce them, because we need to get that movement there where we are in a position where we can have these conversations, because our patients should be at the heart of everything we do, and we want to improve our patient outcomes, and we can only do that when your staff, your team are in the right place. So this is something you could all take back and say, I was looking at this, listening to this lady go on about speaking up, but actually it's made me think, how can we really embed a speaking and listening up culture in where we work to improve everything for everyone? Now, this is definitely for managers or people that you're going to speak up to. Speak less and listen more. Now, I always say all of us can be in that position where someone might come to us and speak up. And it's really easy to, talk a lot. Don't worry, I'm going to sort this out, but actually sometimes you need to remain quiet and just listen to what that individual is saying, and focus on not who is saying it, but what is being said. And we all need to role model that. we all need to role model being that person that, one, will have the confidence to speak up, and secondly, also be that person that listens to what's being said. That there's something that I always go by as well: listen to the silence. So if I go to a team, and especially even when I was an EQA, if I was doing a visit or a review, sometimes when people had nothing to say at all, I think, why have they got nothing to say? You listen to the silence, and that actually can tell you a lot more of what is going on, the culture of an environment, than when people speak. It's really interesting. The comments here,
Yeah.
if you are our head nurse and the only person you can speak to is your PM, and she doesn't do anything about a major concern. Now, if that's what's happening, that's when you need to look on, drawing from your colleagues at the BADN, like reaching out to the GDC, reaching out to your indemnity, those get advice. If it's a major concern and they're not listening, it may be that you need to escalate higher. Now, what I'd really encourage you to do is ask about your raising concerns policy and have a look at it and think about, actually, have you got all different routes that you could speak to different people? It could be that you work in an environment where you could say, do you know what, we could have some champions. Can we have like the well-being champion, or who also is the speak up champion? Could be that person that people can reach out to and say, do you know what, I don't know what to do about this, who can I speak to? And they can support people and signpost them, not take on speaking up cases, but actually say, you know, I'll arrange a meeting for you to sit down with this person and have a chat. It could be something like that that you could start to lead on and be instrumental in enabling those conversations to go ahead. We've all got things, sometimes you feel powerless, but there are things that you can do to help shape the environment that you work in. And we do say culture comes from the top, but it also takes everybody in that team to move that culture into the right place. It can't just be down to a couple of people. It's got to be down to everybody to want to be moving in the right direction. And if your patients are at the heart of what you do, we know that team has got to be in the right place. So this is where you can steer it. Think about your patient outcomes. Patients pick up on a lot. They really do. Think about when you're a patient, when you put yourself on the other side, you pick up on a lot. Those conversations between each other, how the staff, their body language around each other, how they interact. Sometimes it's not what they say, it's how they say it. And also those looks between staff, you know, you do sit there and you absorb all that. And you must have been places, I'm sure you have, where maybe you've gone for a hospital appointment, or I don't know, go for a dental appointment, and you think, it's not very friendly here, or it's a bit off key, or you might have gone to work somewhere and you think, I don't really like it, something's not
Some
right.
patients also complain about the treatment that they received, and how sometimes that they didn't like the atmosphere, and how the dentist was speaking to the dental nurse. So there are complaints that do come through from the patients.
Yeah, and that's something whoever manages those complaints needs to be looking into, because if a patient is sitting there, 9 times out of 10, a patient will think, I've had my treatment, I probably won't go back, I didn't really like it. But for them to actually raise a concern shows how much it's had an impact on them. I wouldn't want to be anywhere, because I think if they can be rude to another professional, they can, you know, potentially take it out on me as a patient. So that's something that your practice needs to be sitting up and thinking, maybe we should speak to the nurse. How do you feel when you're in the surgery with so and so? Or, you know, what's it like? How, you know, what's the environment like? Do you feel that you can ask a question? How are you addressed in front of the patients? How are you addressed when there are no patients? Is there a difference? Because there shouldn't be. Someone should be polite and respectful to you all the time, regardless who else is in that room or in the vicinity. Has anyone got any questions? Oh, Michelle, sorry.
No, it's often, when you're in surgery, I find us nurses often have more professionalism about situation. So you can get a dentist or a hygienist or whoever say something to you while the patient's in the chair, but a lot of us will not answer back because actually we're really professional.
Yeah.
You have to sit there and work through it. And yeah, that I think that's a big situation where we're actually more professional. I don't know if anybody else that's happened to, but I just wonder if maybe I shouldn't be as professional and just call it out in front of the patient. Obviously, I don't, but
No,
they get around.
they do. I think it's one of those conversations after. When you spoke to me in front of the patient, I didn't say anything, but actually, this is how it made me feel. Was that your intention? Or, and again, it's about how you structure those conversations. But you can say I didn't say anything because the patient was there and I didn't think it was professional. However, going forwards, it could be, and I've said this to people before, just reflect on this. What is it like to be on the receiving end of you? Go and have a think about it. And if you wouldn't want to be on the receiving end of you, no one else should be. But it's actually, I think that a lot of us can learn from, just because it can make you think, how do I actually land with people? Because I probably, hope to come across with good intention sometimes, and maybe, I don't know, maybe my tone has been off, or, it happens, doesn't it? Oh, you don't fully know how you land with someone, but I think being able to have those conversations, using tools with the people you work at, such as 360 feedback. Does anybody use 360 feedback?
No, but I've heard of it.
That could be a really good way to highlight areas that you are very good at, that an individual is admired by by their colleagues, but it can also highlight areas that you need to develop. So for example, if I did a 360 feedback, I could ask various people that I work with, and do you find me approachable, do you find me knowledgeable, all those type of questions. And then if people, a few people come back and it's like, well, actually you can be a bit blunt sometimes, but it doesn't say who said it. So there's no attachment to a name because you've sent it out to multiple people, but there's common themes coming through. That is, as a person, you could use that to help you grow. Some people might come back and say, do you know what, I really like it, or I find it really good when you do X, Y, and Z. And sometimes, and that happens, you think people admire you for things that you've not even been aware of. But also on the other way, it can help you improve, and you can think, oh, actually, maybe my tone is a bit off. Maybe I do get a bit snappy when I'm feeling under pressure and I've got a patient in the chair and things aren't going quite as smoothly as I thought they were. And I've got another patient waiting and I've got another patient waiting and it's all getting a bit tense and I've ended up snapping at the person that I'm working with. And, I need to recognise when I'm getting a bit stressed to not take it out on who I'm working with. It could be, things like that could be a really good way to help improve and support your working environment. Another thing that I'm actually a coach. I did a level 5 apprenticeship a couple of years ago in coaching, and that I've found as one, supported individuals to develop, but also teams. You can have people go in and do team coaching. And as a team, what is your goal? As a team, where do you want to be? What type of team do you want to be in? And that can really help people to explore where they want to work, as in what place they want to be, what culture do they want in that team. Do they want a culture where you can be in a meeting, pop your hand up and say, I've got a concern about this, or I'm worried about this, or, you know, what routes have you got that you can talk about things and people will sit and listen to what is actually being said? That's something that you can start to put in to focus on where you want to be, because you all want to be in a professional work environment. You've come here on a Saturday at 3 o'clock to keep your knowledge up to date and also to have these discussions. So you're all keen individuals, you're professionals that want the best within your working environment. So start to think about how you can embed that where you work. Has anyone got any questions at all? So what I'd like you to do is, have a look at your speaking up, raising concern or whistleblowing policy, and have a think about the individuals that you could approach if you wanted to speak up. But also, what would you say to someone else if they come and spoke to you? What would you do? What would you say? Now, what I always say to anybody that comes to speak to me, this is confidential. However, if there's a safeguarding concern, we will have a discussion on what we are going to do next, because I cannot say I'm not going to say anything if you're like my colleague's planning, I don't know, to jump out the window and you're the only one that knows. I can't not say anything. We're going to have that discussion, but it's about having that transparency and being really honest with someone and say, this is a big concern, we're going to have to raise this. Otherwise, we can have a conversation and say, this is confidential. And what we're going to do next, what are the next steps that we're going to do to address this situation that you're either in or you can see is happening, and it having that transparency and that trust, building up the trust. Oh yeah, Sarah's just putting, she was one of my coaches for my apprenticeship. When if anyone's had an EPA, you're being observed. Sarah was very kindly was my coachee. So if we look at standard 8.1, that is all about, you must raise a concern, put them in front of me, any concern that patients might be at risk at, and it lists it all. And it also talks about no employer can have a gagging clause in their contract. You know, so it's very, it is actually peppered, I'd say, peppered throughout those standards about, look, 8.2, you must act on concerns promptly. Acting quickly may mean that poor practice is identified and tackled without there being serious risk to patient safety. There's a lot about, as a professional, speaking up and raising those concerns. But what we want to do is we want to have speaking up business as usual, not this big, oh, I'm going to whistle blow this. Do you know what? I'm a little bit concerned, or because often these things have layered up over years, haven't they? And if we can get to it early on, you can help resolve issues and prevent anybody from having harm, or like in Mary's case, get into that situation. If people had listened early on, we wouldn't all be facing that stress.
But I think the GDC is concerned with concerns that affect patients only.
Yeah.
So all of that applies, but only if the patients are at risk. And if people ring the BADN office, we do say to them, as a registrant, if you think patients are being put at risk, you have a responsibility to do something about it and to, you know, inform the GDC if that's appropriate.
Yeah.
And we also suggest that they take notes of every time that they have raised it with the principal or the employer or somebody above them, so that basically to cover themselves, so that when the GDC do, or if the GDC hear about it from somebody else, that person can show that they have raised those concerns and that they were being ignored. But I think, again, when you're talking about concerns that are not necessarily for patients, but for other members of staff, then it becomes a lot trickier, because the GDC are not really interested in those. They're only interested in those ones which affect patients.
Yeah, and I totally agree about keeping a journal.
Yeah.
Keeping a journal of just some notes, raised X, Y, and Z on this date, because you don't know when you might need to go back and have those dates and times to mind, and maybe who witnessed X, Y, and Z as well. I totally agree with that. I think it's the best way, because sometimes things do go over a period of time. It's really hard to say, oh, I think it was last October that I said, but I'm not sure who was there. But if you've done some notes and that kept that journal, or, you know, I did raise X, Y, and Z, was a concerned, you know, then it demonstrates that it does cover yourself as well, but it can also show how long a situation has been going on for as well.
Yeah. Okay, does anybody else have any questions for Sally, or any observations or comments?
Heidi has just asked, is there training for individuals who want to be guardians? So what's the training pathway like for, what has it been like for yourself, Sally?
Yeah, so to be an actual guardian, you have to, well, once you become a guardian, as in you get taken a guardian role, then you have to undergo your training. The National Guardian's Office, we have got guardians that work in the private sector as well. So you could contact the National Guardian's Office and see what training they would be able to offer and how it works in private practice. Obviously, I'm only familiar with the NHS structure and the policies we got there. But do you know what? In banks now, they have guardians, freedom to speak up guardians as well. They've got, so it is a role that is in lots of different areas. But what you could also have is, if you work in a corporate environment, there could be champions as well. So I have a number of champions that work for me. They kind of signpost people where to go, but any actual freedom to speak up issue cases, me and my manager, we manage those. But yeah, the National Guardian's Office, if you go onto their website, they've got lots of information there, and you can always drop them an email as well. They're very, very helpful, and we have a big conference every year as well, and lots of people from different areas, private and NHS, come and talk about what their guardian role is. Do you know what, even they don't actually call them guardians, but the BBC, they're called head of whistleblowing and things like that. There are now lots of these similar roles that are popping up in different environments. I think it's as more cases and situations have evolved, that companies have realised you do need people that staff can go to. And I've seen that some Mary's put that in the policies, they should contain people, places you can raise a concern with and get advice and support. I 100%. I totally agree with that, because if you've gone to your line manager and your line manager isn't listening, or you perceive them not to be listening, you do need to know where to go. Like it could be, if you're in a chain of practices, that you can reach out to someone in a different practice and have a conversation with. You know, they need to be able to, and that could be where there are these champions, for example, because it's not always easy to have conversations with people that you work day in and day out with, and they might know the other characters involved, and obviously everyone's got their own perception on a situation. However, by talking to someone, a different practice that might be under your corporate umbrella, for example, you would be able to get more independent and impartial advice. Because one of the values of being a guardian is being impartial. Because I always know, whatever someone comes to tell me, there's another side to the story, but you know, it's about remaining impartial, but supporting someone to help get that concern raised.
Right. Does anybody have anything else they would like to contribute?
Do you think it's a good idea, like if we've raised a concern verbally, as it's quite hard as a dental nurse anyway, I feel, is it a good idea to follow it up with an email to say like we've discussed this today, and because I know we can keep a diary, you know, or a journal, but you know, to actually confirm that we've had this conversation with this person at this date and time.
I mean, I think that would be a good idea. It just depends how comfortable people feel. I mean, I am always on those people that will, you know, follow up. Oh, as we discussed earlier, but that's also so they've got a paper trail as well of my communications. And I think it really depends on the environment that you work. If you feel comfortable in doing that. But Mary just put a good point. She said if you email yourself the notes, then they're dated as well, and you can keep that in a file. But yeah, I think again, it also depends how you word your email as well, because sometimes it can make people feel a bit like, oh, what's going on here, rather than, you know, oh, thanks for talking to me earlier. It's made me feel a lot better. As we agreed, I'm gonna do You know, I think again, it's all about not what you say, but how you say it, and how you can build up that collaborative, like, working environment that you're trying to get to the same goal. Because I think what happens is if it feels a little bit harsh, the email, people start to go into protective mode, rather than maybe solution focused mode. So yeah, I think it just really depends.
Thank you.
Yeah. See you, everybody. Thank you.
See you. Thank
Thanks
you,
a lot.
Sally. Thank you very much.
Bye.
Bye, everybody.
Thank you. Bye.